Hi everybody, I'm Dr. Denise Rassel with Rassel-Daigneault Holistic Health Center, and today we have our very special guest, Tonjala. I'm not going to say her last name because, I think she's single. The reason why we're getting together today is because I love Tonjala, and I've known her, I'm not sure how many years, probably 7, 8 years, and I wanted her to be able to share her story of being with us chiropractically through her 7, 8 years of how she met us and what her health was like before, her experience being under chiropractic care for 7 or 8 years. And so let's start off with that. And we're going to ask, first question will be, Tonjala, how did you meet us?
You all had a booth at the Women's Conference at the Lansing Center, and I stopped by the booth, and I think that time I wasn't looking for you guys as a patient, really. I was a distributor for a health and wellness company, and I was trying to meet chiropractors in the area. So for me, it was more about networking. And then I came to one of the health classes, and I started learning about chiropractic care and how your spine is supposed to be aligned. And so that's what piqued my interest for me to become a patient.
And she's, patient means you're implied that you have something wrong with you. She doesn't have anything wrong with her. She's been utilizing chiropractic for proactive measures for 8 years.
Mm-hmm.
So what was the main reason why you chose to do proactive chiropractic care? I mean, you were pretty young when you first started, right? You were at Lansing Community College, if I remember correctly.
Yep, and that's where I still work. For me, I had back pain. So I've had 3 car accidents over the course of my lifespan. And so the first one was pretty major. I didn't even think I was going to make it out of that car accident. So I literally saw the newspaper headline of my death because the car flipped over 3 times. And so the orthopedic specialist told me that I would probably always have back pain. So when I came here, my back would just ache a lot. And so the chiropractic care really helped to reduce the pain and reduce the inflammation. Mm-hmm. So my lower back will always ache. And so that was one of the major reasons why I came, because I heard Dr. Jean-Guy's presentation about how your spine is often misaligned throughout the events of your life. And knowing that I had that car accident, I was 17 at the time, and then when I was 23, I was sitting at a light and I was rear-ended. So those were 2 very high impact car accidents, and I could just imagine how my spine had been misaligned throughout that. So that was the motivating factor for me to start coming to do chiropractic care. So
did you have your second car accident while you were under chiropractic care? Before, and then
the third accident was maybe just like a fender bender. After I left chiropractic, I came in and I got an adjustment, and I was sitting at the light, and I think the person kind of ran the light, and so it was a fender bender, and I turned right back around and came and got an adjustment. So, yeah.
Wow. So you've been under chiropractic care for now 8 years, 7 or 8 years, and what do you find is the benefit, the biggest benefit to you? Why have you stayed under chiropractic care, and what could you tell someone who has maybe never even considered chiropractic care?
So this center is very different from some of the others because it's about a lifestyle. So for me, I not only do chiropractic care, but I do the massages and the nutrition. So I would encourage someone to find a center like this if you're not local. Find somewhere in your local area. But if you're here in Lansing, to come over, the team is wonderful. Everyone is very friendly. And I think the atmosphere really sets the tone to receive the care, because I feel it's about the care, but it's also about the education. So things that I've learned here about my diet, about what inflammation is, and about how to really use food as your health and your medicine. And I'm on my journey in that area, so it's not great. But it's definitely an improvement over what it has been. So there are times when I've come here, even just last week, I was so tired. I'm in the middle of a really big move, and so I just have a lot of things going on, and I felt it in my body. But I came in last Tuesday, you adjusted me, and Vivian gave me a massage, and when I left, I felt like I could take on anything. It was a very big difference. I mean, I was really just physically down. The weight of the work and the move, you can just feel it in my body. And when I left, I was like, wow, this is amazing. So much better, I felt 100 times better.
Well, I find it amazing because, I look at you and you're a young person. And not many young people actually take their health into consideration, and you have invested your time, your money, not just and money and time, because when you come here, it may not just be a get in, get out adjustment. You're coming here, you're getting adjusted. I know you've done traction. You're getting a massage, you're having your nutrition visit. Insurance does not cover nutritional supplements either. So as a young person, you have invested time, money that
it's when I first came here, I did the overview. We talked about what the plan would be, and I had to come 3 times a week. So I was coming before work, and at that time, my traction time, we were working up to 20 minutes. So that was about 45 minutes in the morning onto my day that I hadn't allotted for. I just thought I was going to come in 5 minutes, but then when I started learning, I was like, oh, this is a really serious investment, but I realized that I'm worth it. I have a huge vision for my life, and not just me, but God has a huge vision for my life. And to do the work that I'm called to do, I have to be healthy. I have to be able to, get up in the morning, travel. I advise for a living, so I'm listening to people all day long. I'm listening to problems, trying to find solutions. And if I'm not in the best mental space to do that, it doesn't go very well. So for me, I just know that it's about the life that I want to live. And Dr. Jean-Guy, I remember doing one of his presentations, he was like, if you could just do one more thing to improve your health, because being healthy is an overall lifestyle. So under your care, I started going to the gym, and I learned about what my lymphatic system does and how that needs to be flushed, and that happens through high intense cardio. So I was like, well, I got to get a gym membership. I have to run. I started investing in footwear to just help improve my life. And so I just thought, okay, what's one thing that I can do? But the benefit is that it's a triple down effect. So my mom is on supplements. Yeah.
Triple down.
So my mom is on supplements now. And they're in Alabama, but we found a similar chiropractic center that offers the same or similar services. So she's on supplements. My father, I got him started on supplements because I realized I just can't get all the nutrition in the food. And I don't cook enough. And so I know based on what I cook about the level of quality nutrition that my body is getting. And so I've realized, you know, that I need to supplement. And with the nutritional response testing, it's amazing how, you know, the staff can test your organs and see what is missing. And those things are not covered by health insurance. But I realized after seeing so many people in my family struggle with different health ailments that I just wanted to do a little bit more to reduce the likelihood of that happening in my life. And just to be healthy, I enjoy life. I enjoy people. I enjoy work. I enjoy living and traveling. And when you're down, or when I'm down, when I'm sick, it doesn't allow me to enjoy life like the way I want to.
Yeah. Well, see, Tonjala is the poster child of you know, this is what we live for. You know, when I first got into chiropractic school, you know, I love adults and we want everyone to feel really good. However, our heart has been for children to grow up under chiropractic, eating well, moving well, and living well, because doing that is going to reduce a human being's odds in a disease process, or, you know, heaven forbid, cancer. So our, you know, Tonjala is like the poster child of a young person getting the big idea about health and investing into yourself, and, you know, through chiropractic, diet, exercise. And you know, it's really rare to find a young person that invests in themselves and gets the big picture about their future health. And for Tonjala, you have not only taken it upon yourself and invested into yourself, but you also have shared the experience with your family, and quite possibly changing their health trajectory to a better health outcome, living longer. And it's exciting. I'm sad that you're moving, but I know that I feel the same way. I really feel like God has big plans for you. You're going to affect the world, not just your little niche is your ability to communicate and to listen and to strategize for, I'm not sure who, but I know that God has definitely gifted you. And I'm so glad that we here were able to be part of that, you know, that watch you grow up. I mean, 7 years in college, you know, you kind of grew up underneath into a beautiful young lady, and now you're not so young anymore. You're growing up and moving away, and you know, I just want to say we love you and we appreciate have been able to be part of that Tonjala, not going to say her last name, story. But you know, if you do need to, you know, communicate with Tonjala, you'll have to go through me first. So I love you.
I love you too.
So thank you for today, and if anybody has any questions or about chiropractic nutrition, I'm always available. Thank you.